If you are exhausted or tired all the time, you may say you're fatigued, but diagnosing fatigue is more complex than you may think. Here to unveil the many faces of fatigue is Dr. Mikell Parsons with the Natural Path Health Center. Thanks for being here again, Dr. P. It's good to see you.
Thanks for having me.
It just seems that everyone around you is fatigued, including, yourself, probably not you, but
not no.
It just seems everywhere you turn, hey, how's it going? Oh, fine, I'm tired, though.
Yeah.
What exactly is fatigue aside from just being tired all the time? Is that what it is, basically?
Well, fatigue has many forms, and it happens at different times, in different ways, in different people. But one of the things that I wanted to focus on is there are a tremendous amount of people out there who, if they have to wake up before 10, they're tired. Now, they can still get up, they can still function, but they're tired. Their brain doesn't click on until around 9 or 10.
And most people do have to wake up way before 10.
Exactly. And then some of those same people will notice they get a slump in the afternoon, usually between 2 and 4. They might perk up again around 6 or after dinner. And then they'll notice if they don't get into bed before 11, if they stay up past 11, they are energized. They are ramped up.
Some people are night creatures, and they like to do things at night. These are some of the signs of fatigue, and that is included as one of the signs.
Yes.
That really.
So these are all flags. Okay, these are flags that something is out of balance, something's wrong. We have hormones that are secreted in a certain pattern throughout the day. We're supposed to wake up right before the alarm goes off.
Oh, we're supposed to?
We're supposed to be a little bit awake before that alarm goes off, and our level of perkiness and energy should be high throughout the whole day. No slumps, no fatigue, no getting your second wind without coffee. Now, just a side note, people will say, my energy's fine. And then we'll talk about coffee, and they'll say, well, I have to have my coffee. Don't talk to me before I have my coffee. I'm grumpy before. It's all about the coffee. People who are dependent on coffee have fake energy. You're forcing a tired system to work.
Is that bad?
Beating a dead horse does not cause the horse to work harder, right? You aren't going to get a good effect.
Ruben's saying in my ear, does that sound familiar? I am not grumpy before my first cup of coffee, Ruben. I just don't like to talk, that's all.
Just don't talk to her. So that's a sign of a problem in the system.
What if you have one of these signs but maybe not the other? So let's say you don't perk up after 11 and you get really tired. Does that still mean you are suffering from some sort of fatiguedness?
Yes, because once again, we should have good energy throughout the day. We should wake up feeling good. When we go to bed and wind down, we should fall asleep quickly. And it should be day after day after day. So there might be someone who says, well, I've got 2 out of that list, so I'm not that bad. Are you going to wait until you get that bad? Those are warning signs. That's your body saying, okay, we've got a problem. We need to shut down because we don't have enough energy to keep you going at a good energy throughout the whole day.
Is there something other than not sleeping that causes fatigue?
There's a lot of different causes. One for women could be low iron. So if you don't have enough iron or you're low in your B vitamins, that's a sign. But a bigger sign of a bigger picture is a fatigue with your adrenal glands. Now, your adrenal glands are glands that they're responsible for a lot of different body functions, and we'll go over more of this with future segments. But when the adrenal glands start to get tired, it's not like you have a disease. Okay, you don't have an adrenal disease, but they're not functioning at 100%. When they start to function maybe at 80%, maybe you're waking up and you're just a little cloudy thinking. You got that fogginess. Or, you have to make sure you eat. That's another sign. That hypoglycemia, dips in the blood sugar, is another sign because the system isn't being fueled properly to manage the amount of work that you're making the adrenal glands do.
So how do we fuel our system? In other words, how do we treat this?
One of the things is making sure that you're eating. We always go back to that darn food thing. Darn it. But
food is kind of important, isn't it?
Yeah. There's a way around it. I'm going to let you guys know. But we want to be eating protein several times a day. Now, another sign of a potential adrenal problem is when we lean more towards the salty kinds of foods, chips, pretzels, soups, the canned soups. They have a lot of salt in them. So you might not think, well, I don't do a lot of salting when I'm cooking or when I'm eating my food, but what is the food that you're eating? If it's prepackaged, pre-prepared, there's a lot of salt in those things.
Okay. And so if you crave these kind of foods, that's a sign that you may be feeling fatigued. Wow. Okay.
Yes.
Okay. So I'm sure a lot of people have many, many questions about fatigue. And can they call you and ask you? And I'm sure you have other things that you can offer to them. And can we continue talking about this? Because I think we could just...
This is a huge problem.
This is a huge problem for a lot of people.
This is the #1 complaint I have with all of my patients in the office.
The good thing is it can be fixed with the help of Dr. P. She's at the Natural Path Health Center, which is located at 745 East Locust. Easy to get there.
Very easy.
All right, that's Suite 110. 447-1404 is the number. Give her a call. Thank you so much, and we'll see you next week. Let's talk about fatigue.
Yes, and people can go to my website. I'm going to be releasing some information on vitamin C and the adrenals. So if you sign up in the next 24 hours, you will get this newsletter.
Okay, and
that's naturalpathfresno.com.
That is, and then we eventually will get into a program that you have that people can call in with their concerns and questions, and you can help them out.
That's right.
All right. Dr. Parsons, thank you so much for being here. We'll see you again next week. Don't go away, everyone. There's more Central Valley Today coming up right after this.